Fentanyl is a powerful synthetic opioid that is used legally for medical purposes, but is also manufactured and distributed illicitly, which is the primary driver of the overdose crisis in the United States. Legal use in the U.S. pharmaceutical fentanyl is an FDA-approved prescription medication used for pain management. It is a Schedule II controlled substance, meaning it has a high potential for abuse, but also has a recognized medical purpose. Legal medical uses include anesthesia during surgeries, management of severe or chronic pain, especially for cancer patients who are already tolerant to other opioids, treatment of breakthrough cancer pain, sudden episodes of pain despite around-the-clock medication. It is administered under medical supervision in various forms, such as transdermal patches, lozenges, or injections. Non-legal, illicit use. Illicitly manufactured fentanyl, IMF, is produced in clandestine labs and sold on the illegal drug market, often without the user's knowledge. Due to its extreme potency and low production cost, drug dealers often mix it with other substances to increase potency or create counterfeit prescription pills, e.g., fake oxycodone or Xanax. Common non-legal uses include mixing with other illicit drugs, such as heroin, cocaine, or methamphetamine, to create a stronger effect or lower costs. Sold as powder or liquid in the illegal market. Pressed into counterfeit pills that look like genuine prescription medication. The lack of quality control in illicit production means these substances often contain lethal doses of fentanyl, contributing to the high rate of fatal overdoses. Fentanyl-related deaths in the USA. Fentanyl has been a major driver of the increase in U.S. overdose deaths since around 2013. Recent data on deaths involving synthetic opioids, primarily fentanyl. In 2022, approximately 75,000 people died from overdoses involving synthetic opioids. In 2023, 72,776 people died from fentanyl overdoses nationwide. In one recent year, fiscal year 2024 data, synthetic opioids, primarily fentanyl, accounted for 60% of all overdose deaths in the U.S., which was about 48,000 people. It is currently the leading cause of death for adults aged 18 to 45 in the United States of America. The global fentanyl crisis begins far from American borders, in chemical laboratories across China, where precursor substances are manufactured. The exact number of fentanyl precursors is difficult to state definitively due to the constant changes in chemicals and synthetic methods used by illicit manufacturers to avoid detection. However, various sources offer insights into the number of controlled and potential precursors. A 2022 report estimated that over 3,100 chemicals could potentially be used to make fentanyl and related substances. As of July 2025, more than 30 fentanyl-related substances, including several key precursors, were under international control by the United Nations. This includes 2 precursors, NPP and ANPP, controlled since 2017, 3 more, norfentanyl, 4AP, and 1 bioc-4AP added in 2022, and 2 more, 4-piperidone and 1 bok-4-piperidone, added in 2024. The U.S. has a list of controlled precursors, and a 2024 report by China mentioned an appendix identifying all 51 U.S.-listed precursors. Mexico reportedly controls 8 specific precursors and has a watch list of over a dozen more. Some commonly encountered precursors include NPP, ANPP, 4AP, 4-piperidone, 1-bioc-4AP, norfentanyl, propionyl chloride, and propionic anhydride. The actual number of precursors used in illicit synthesis fluctuates depending on which chemicals are currently unregulated. This is for informational purposes only. For medical advice or diagnosis, consult a professional. AI responses may include mistakes. These chemicals are often shipped, sometimes under false documentation, to Latin America, where powerful cartels operate clandestine labs to synthesize fentanyl. Once produced, the drug is trafficked northward, crossing borders and infiltrating communities throughout the United States. U.S. agencies such as Customs and Border Protection deploy advanced technology and intelligence to intercept shipments at ports of entry and along major transit routes. Collaboration with international partners is essential, as joint operations with Latin American authorities help dismantle trafficking networks and seize illicit substances before they reach American soil. This coordinated approach aims to disrupt every link in the supply chain, making it harder for fentanyl to move from distant chemical plants to local streets. The United States employs a multifaceted strategy in Latin America to combat the flow of fentanyl and its precursors. Multinational military operations, such as Operation Martillo, bring together U.S. forces and regional partners to patrol key maritime routes and disrupt drug shipments before they reach American shores. Beyond military efforts, the U.S. invests in capacity building for local law enforcement, providing training and resources to help countries like Mexico detect and intercept both finished fentanyl and the chemicals used to produce it. Sanctions are another critical tool, with the Treasury Department targeting companies suspected of supplying cartels with precursor chemicals. Legal actions, including indictments and extraditions, further weaken trafficking networks by holding suppliers and cartel leaders accountable. Together, these approaches aim to dismantle the supply chain at multiple points, reducing the threat before it reaches U.S. communities. To address the fentanyl crisis, the United States has expanded its strategy beyond traditional law enforcement. The Trump administration's approach to the war on drugs has involved a two-pronged strategy: a public health focus on prevention, treatment, and recovery, coupled with a significant escalation in military and law enforcement tactics abroad, particularly targeting cartels as terrorist organizations. Domestic strategy. Domestically, the administration's policy, outlined in its National Drug Control Strategy, aimed to address the substance use disorder crisis by balancing public health and safety concerns. Key elements included prevention, promoting safe prescribing practices, expanding prescription drug monitoring programs, and supporting community-based efforts to discourage drug use. Treatment and recovery, expanding access to evidence-based addiction treatment, supporting long-term recovery through drug courts and peer services, and using media campaigns to reduce the stigma of addiction. Overdose. Response. Improving the public's response to overdoses, including expanding the distribution of the life-saving medication naloxone. International and enforcement strategy. Internationally, the approach has been characterized by a notable shift toward a more aggressive, militarized response, blurring the lines between crime control and counterterrorism. Designating cartels as terrorists. The administration has designated several major Latin American drug cartels, including the Sinaloa and Jalisco New Generation cartels, as foreign terrorist organizations, FTOs, and specially designated global terrorists, SDGTs. This move unlocks counter-terrorism tools, such as sanctions and asset freezes, and provides a legal justification for the use of military force. Military action. President Trump has declared the U.S. is in a non-international armed conflict with these groups, a legal stance that allows for military action. Since September 2025, reflecting the current information from the search results, the U.S. military has conducted numerous lethal strikes on suspected drug smuggling boats in international waters off the coasts of Venezuela and in the Caribbean and Pacific, resulting in dozens of deaths. Geopolitical focus. The actions have a strong geopolitical dimension, involving a pressure campaign against Venezuelan President Nicolás Maduro and a diplomatic rift with Colombia. The administration has also explored potential military missions in Mexico to target cartels. Interdiction. The strategy emphasized disrupting the flow of drugs across U.S. borders, including targeting internet sales on the dark web and enhancing cooperation with domestic and foreign law enforcement partners. These military actions have faced criticism from some lawmakers and legal experts who question their legality and the lack of congressional authorization for a sustained military campaign, as well as the conflation of drug trafficking with a direct armed attack against the U.S. diplomatic engagement plays a central role, with the U.S. re-establishing counter-narcotics working groups alongside China to specifically target the flow of precursor chemicals used in synthetic opioid production. Economic measures have also been deployed, including the imposition of new sanctions and tariffs on Chinese chemical imports linked to illicit fentanyl manufacturing. These actions are designed to disrupt the supply chain at its source and pressure foreign companies to comply with stricter regulations. Domestically, the U.S. has introduced new rules to track and regulate pill press equipment, aiming to prevent the production of counterfeit pills containing fentanyl. Together, these diplomatic, economic, and regulatory efforts form a multi-layered approach to curbing the epidemic and safeguarding public health. In a pivotal moment for international drug control, the U.S. President Donald Trump met with his Chinese counterpart in October 2025, signaling that the fentanyl crisis has risen from a health concern to the highest levels of global diplomacy. President Donald Trump and Chinese President Xi Jinping met in Busan, South Korea, on October 30, 2025, on the sidelines of the APEC summit, where they reached an agreement to cooperate on stopping the flow of fentanyl precursors to the United States through South America. Key outcomes related to this issue included: China agreed to impose controls and require licenses for the export of 13 specific precursor chemicals used to manufacture fentanyl, especially those destined for North America, the US, Mexico, and Canada. In response to China's commitment, the U.S. agreed to lower its fentanyl-related tariffs on Chinese goods from 20% to 10%. Details of the agreement and implementation steps were later confirmed by both the White House in a fact sheet published November 1, 2025, White House fact sheet, and by China's Ministry of Commerce, MOFCOM. The negotiations center on the export of precursor chemicals, essential ingredients in synthetic opioid production. American officials press for tighter Chinese regulations, demanding robust oversight of chemical manufacturers and stricter export controls. In exchange, the U.S. offers phased relief from newly imposed tariffs, as well as expanded cooperation in technology and trade. Both sides agree to establish joint enforcement mechanisms, including increased inspections, data sharing, and a verification task force to monitor compliance. The diplomatic challenge lies in balancing economic incentives with regulatory commitments, as each nation seeks to protect its interests while addressing a shared public health threat. This high-stakes dialogue underscores the complex interplay between trade, security, and global responsibility in the fight against fentanyl. Despite significant efforts, the fight against fentanyl faces persistent risks and unresolved challenges. Diplomatic tensions with China remain a major obstacle, as Chinese officials often cite the dual-use nature of chemical exports and resist stricter regulations that could impact legitimate industries. Tracking chemical shipments is inherently difficult. Traffickers frequently conceal, mislabel, or reroute precursor chemicals through third countries to evade detection. In Latin America, concerns about national sovereignty complicate U.S. interventions, with some governments wary of external military or economic pressure. Meanwhile, trafficking networks continue to adapt, shifting to new precursors, developing alternative smuggling routes, and leveraging emerging chemical innovations. These factors underscore the complexity of the crisis and highlight the need for sustained, multifaceted strategies moving forward. Success in combating the fentanyl epidemic would be marked by a significant reduction in the flow of precursor chemicals into Latin America and the United States, achieved through robust enforcement and diplomatic agreements. Regional law enforcement agencies would be better equipped and trained, enabling them to dismantle clandestine labs and intercept trafficking networks more effectively. A sustained decline in overdose deaths would signal that prevention and treatment efforts are reaching those most at risk. Beyond immediate enforcement, a durable international framework would emerge, fostering ongoing cooperation between countries and treating fentanyl as both a public health and foreign policy challenge. Ultimately, success would mean building trust among nations and communities, ensuring that strategies are resilient and adaptable to evolving threats. This comprehensive approach would lay the foundation for lasting progress against the crisis. The fight against the fentanyl epidemic is far more than a matter of law enforcement or international diplomacy. It is a complex challenge that demands a coordinated, multifaceted response. From legislative reforms and sanctions to military operations and diplomatic negotiations, the United States has mobilized a wide array of strategies. Yet lasting progress depends not only on government action, but also on cooperation between nations, communities, and individuals. Public awareness and education remain crucial in reducing harm and preventing new tragedies. Ultimately, ending this crisis will require sustained commitment, adaptability, and unity across all levels of society. Only through persistent collaboration and vigilance can the devastating impact of fentanyl be overcome. If you found this information helpful, please support our channel by giving this video a thumbs up and leaving a comment below. To ensure you never miss out on future health tips and updates, consider subscribing for more content.